Hello, I'm Dr. Maury Markman from City of Hope. And in this session of Minister Markman, I'd like to discuss the final abstract of the four that I presented from the 2005 ASCO meetings. Just again, the purpose of this was to emphasize several very important studies that give us pause, ask us to think, ask us to consider options that are relevant for our patients moving forward, that are, quite frankly, not drug-related, and very importantly, may not get enough attention in a very large meeting like ASCO. So in this final section, I'm going to discuss a paper. It was actually an abstract that was entitled "A Randomized Phase 3 Trial of the Impact of a Structured Exercise Program on Disease-Free Survival in Stage 3 or High-Risk Stage 2 colon cancer, Canadian Cancer Trials Group Challenge Study." I emphasize the Canadian nature of this. As I'll note, there were other countries involved, but this study was funded largely by the Canadian Cancer Group. This was a critically important study, as I'm going to say now, and I'll say at the conclusion. There had been observational studies that have been reported that have shown that the level of physical activity post-diagnosis of early colon cancer can reduce risk of recurrence. And make it very clear, this is not just colon cancer. We're talking colon cancer in the trial, but there have been other studies reported, epidemiological studies, small studies that have suggested that the level of physical activity, meaning more physical activity, can improve or decrease the risk, improve survival, but decrease the risk of recurrence. Now, obviously, very complicated topic. It's not just, this is not the only thing that someone might do. It might be exercise, it might improve their outcomes. Therapy makes a difference, et cetera, et cetera. But there's this epidemiological data. And 2 points about this, of course, before we move forward is, one, we're not talking about high cost. And two, it's something that a patient can do herself or himself to improve their chances of having a favorable outcome. So this particular trial, randomized phase 3 study, attempted to objectively address, as objectively as one can, objectively address the question of the relevance of physical exercise in reducing the risk of recurrence after early stage, high risk colon cancer. So the challenge trial, as I noted, involved 6 countries, 55 different sites, patients who had resected stage 3 or high risk stage 2 colon cancer. The patients had received adjuvant chemotherapy, and they were randomized to a structured exercise program or health education material. Now, the abstract, as well as the subsequent published paper, goes into details of what this structured exercise program was, how it was evaluated, what the goals were, what was trying to achieve with each individual patient. So that the point is not to go into that here, but it was a very structured program with very specific goals for individual patients. In the individuals who were randomized to the structured program, they worked with a consultant whose goal was to increase the recreational activity over the first 6 months and then to sustain this for at least 5 years. That was the goal of the study. The primary endpoint of the study was disease-free survival, hopefully an improvement. The study was conducted from 2009 to 2024. It was actually a fairly long study in terms of accrual and follow-up. There were a total of 889 patients. This was a large, well-designed, randomized phase 3 trial. 51% of the patients were female. The median follow-up of this population was 7.9 years. Again, very long follow-up, very reasonable follow-up to be able to see the outcome. What is the bottom line? 5-year disease-free survival in the patients who had the structured exercise program was 80% versus 74% in the patients who were randomized to the health education arm of the study, with a hazard ratio of 0.72 and a p-value of 0.17. And 8-year overall survival was 90% in the population who were randomized to the structured exercise program versus 83% in the group who were randomized to the health education program, with a hazard ratio of 0.63 and a p-value of 0.022. A stunning difference associated with the structured exercise program. Let me emphasize again, this is not extremely costly, certainly not compared to the drugs we use today. There's a cost. Obviously, they described the consultant, etc., but compared to the cost of the drugs, need I say more? And this was patients doing something for themselves on their own behalf. Another critically important point. I want to emphasize, in conclusion, the final statement in this abstract. And I would argue that this statement should be read loud and clear as often as necessary. Health systems should incorporate structured exercise programs as standard of care for this patient population. Is there anything else that needs to be said? And I thank you for your attention.